If varicose veins are causing you problems, you are definitely not alone. At Milligan Vein, they help patients every day ease that pain and get active again. Always nice to have James Gooden join us on the show. He's back this morning. Nice to see you.
Thanks for having me back.
So you just told me something that I thought was very interesting. So you said that most of the people you treat, actually to just look at them, you might not even realize that they have this problem because the pain is so deep within their leg. Is that right? Did I hear you
That's
correctly?
right. Most of our patients come to us, they have just that. They have tired, swollen, heavy, achy legs. And they may or may not have the visible sort of red flags of the vein disease, such as the ropey varicose veins or spider veins. Probably only half people present with those, and again, the other half just tired, swollen, heavy, restless legs.
So is it something where if you are a person who's noticed a spider vein or a varicose vein showing, is that an indicator always of a bigger problem?
It can be, and
Okay.
I think if you have to just kind of do an evaluation and think to yourself, well, if you see something like that, are my legs tired? Am I limiting my quality of life? The activities that I like to get out and do, are they sort of curtailed by my symptoms? Am I having trouble sleeping at night? Do I have crampy, achy, restless legs at night? Do I have to get up and rub my legs or walk around the bed? These are sort of the classic complaints that patients come to us with, and they are typically these are treatable in our office with very simple procedures, but it is a process, and I wanted to come on today and just kind of remind everybody that spring and summer are right around the corner, and if you want your legs to feel better and you want to get the most out of your summer and at the same time get the bonus of having your legs look better, then come see me.
Okay, so let's talk about that process a little bit. Step one, it sounds like, is just coming in for that initial consultation, because it could be that someone's seeing something or that they're just feeling something. Might not be vein related, but you can tell them.
Right, and I think we all, after a long day, we like to stick our prop our feet up, but again, if you have sort of just sort of pervasive symptoms that are affecting you on a daily basis, come see me, because there's a good chance it might be related to vein disease, and it's very simple to treat.
You've mentioned that before when you've been on the show, and it's surprising to me because you can do this really day of. Is it typically done in one procedure, or do you come back from multiple?
Well, the average person that I see needs somewhere between 2 to 4 procedures for me to get their veins get their legs sort of tuned up.
Okay. Is it only, how do I ask this, James? Is it something that you can only do to treat the problem as it exists, as opposed to doing something to prevent future problems from emerging?
Well, we do, yes. We treat the existing problem, but by treating the existing problem, we prevent it from progressing to more severe long-term disease.
Okay. When I use the phrase, you can get active again, is that true?
Absolutely.
You can get, okay.
Yeah. I guess on average, the patients tell us they feel like we've shaved maybe 10 to 15 years off their legs in terms of just how they feel.
Wow.
So, yeah.
Are they often living with the problem for a long time, not realizing what it is?
Yeah, most of us just chalk this up to getting older and age catching up with us, and of course we're not as fast as on our feet as we were when we were in our 20s, when we are in our 40s, and we just kind of take that for granted. But for the vast majority of these patients, there's something that we can do to sort of give them their quality of life back.
You think a lot about people who are standing up all day or on concrete floors. You hear about that being a real problem.
I hear that classically, and it has more to do with just more of a sedentary type of job or lifestyle. And if you find yourself standing in the same position for long periods of time, such a cashier or a factory type job, or if you're sitting behind a computer all day, those are the types of patients that we frequently see.
You did not know I was going to ask you, but my lead-in when I said you hear about the concrete floor was going to be to ask you, though, is sitting an equal problem?
It can be.
And you're saying it can be.
Mm-hmm.
So this idea of now you see people walking around the workplace saying, I've got to get in my 10,000 steps. That's a good thing.
Yeah, exercise is great.
Okay.
So exercise, if you can shed a few pounds, that goes a long way.
So weight does play a factor?
Yeah, the biggest factor in terms of why people get this disease is genetics. We can't run away from that, but some of the other things that we can work on our weight, we can work on being more active, and actually the symptoms themselves will keep people from getting active. So
Right.
the sooner you get in to see us, the sooner we can kind of turn things around and get you back on your feet.
I ignorantly asked you before we got on camera about things being covered medically, because my first thought goes to the cosmetic side of it. Maybe that's the woman in me, I don't know. But you said no, that this is almost always medical.
Right. We do cosmetic work, sclerotherapy for spider veins and that sort of thing, but the vast majority of what we do starts with the medical treatment.
Go ahead.
In terms of treating those symptoms again, tired, heavy, achy, restless legs.
Because if it goes untreated and those veins are a problem, that's going to just travel up, right?
Well, yeah, we get chronic inflammation in our legs. It can lead to the browning of the skin. We see that a lot when we're out in the summertime and folks are wearing short pants. Brown skin, or this sort of perpetual tan that you didn't go to the tanning bed for, you didn't lay out in the sun for, and a sort of bronzing of the shins and ankles. If left untreated over time, yeah, that can present as chronic wounds and just really unhealthy legs.
So it's what they do all day, every day, if they specialize with these veins. So if yours are giving you a problem, they will no doubt have seen whatever it is that you're experiencing. So you can find them online at milliganvein.com. That's pretty easy, but they're right there in Cleveland. 961-5682 is the phone number. Give them a call, make an appointment, and you'll be kicking that kickball by the time summer rolls around. Thank you.
Thanks for having me.